how to check your blood glucose levels. Does anybody know what diabetes is? Today I will tell you basic information on how to test your blood glucose levels. Diabetes is the lifelong chronic condition where a person has high blood sugar or blood sugar that is too low. It results when a person is not able to produce insulin or enough insulin to survive. The symptoms are frequent urination, extreme thirst, and intensive hunger. The three main types of diabetes. Type 1 diabetes results from the body's failure to produce insulin. It is also called juvenile diabetes. It requires insulin injections. Type 2 diabetes results from insulin resistance. The cells fail to produce insulin properly or enough insulin to survive. It can be treated with medication or insulin. Gestational diabetes results when a pregnant woman has blood sugar levels that are too high during her pregnancy, but she has not currently had diabetes. Complications from diabetes. It is the 7th leading cause of death. It can lead to permanent disabilities. It can result in poor health. People with diabetes can experience complications such as heart disease, stroke, chronic kidney disease, and amputations. Diabetes is the leading cause of new cases of blindness among adults ages 20 to 74 years old. It is the leading cause of kidney failure and accounts for 44% of cases in 2008. More than 60% of leg and foot amputations are a result of diabetes. Diabetes management and control. Diabetes can lead to serious complications and premature death, but people with diabetes can take steps to control this disease. You can talk to your healthcare provider and ask about how to take care of your body properly. You can ask about new medications and what doses you should take. You need to exercise 30 to 60 minutes most days of the week. You need to stay at a healthy weight. You should check your blood glucose levels very often and take your medicine as prescribed. You should know what foods are good for you and make sure that you eat a proper portion size. How to check your blood glucose. I will show you this because I am a diabetic, so I will show you what each thing is. This is the glucose monitor. It gives you your readings and tells you if your sugar is too high or too low. These are test strips that you insert blood into. This holds the lancet, which is the needle that pricks your finger and draws the blood. First, you insert a strip into the testing meter. You use the barcode and put it into the meter so that the straw faces outward. Next, you will get your lancet and press this to get the needle ready to inject, and then you put it on your finger and press down. You squeeze your finger to draw the blood. It just takes a small amount and you insert the blood into the straw. It starts counting down. My meter takes 5 seconds to read, but other meters take longer. Once it counts down, it will tell you your blood sugar level. The blood glucose levels will range depending on the person. A normal person who is not diabetic should be between the levels of 80 and 100 if they are fasting. After eating a meal, they should be between 170 and 200. 2 to 3 hours after eating, they should be between 120 and 140. For a person who is impaired glucose, when fasting, they should be 101 to 125. After eating, they should be 190 to 230. 2 to 3 hours after eating, they should be 140 to 160. A diabetic person like myself, when fasting, should be 126 or above. After eating, they should be 220 to 300. 2 to 3 hours after eating, they should be 200 or above. Did you know that nearly 26 million Americans have diabetes and an estimated 79 million adults have prediabetes? Diabetes affects 8.3% of all Americans and 11.3% of adults ages 20 and older. 27 of people with diabetes, which is about 7 million Americans, don't even know they have this disease. In 2010 alone, 1.9 million Americans were diagnosed. It is estimated that as many as 1 in 3 adults could have diabetes by 2050 if current trends continue. Women who develop diabetes while pregnant, which is gestational diabetes like we talked about earlier, have a 35 to 60% chance of developing type 2 diabetes in the next 10 to 20 years after pregnancy. Insulin became available in 1921, and it is still being developed, and there are new forms that come out very often. Diabetes is one of the oldest known diseases. It dates back to 1550. World Diabetes Day is November 14th. This blue ring is the diabetes symbol, and it has just commonly been made known. The circle symbolizes life, health, and immunity. It's supposed to represent a world where everybody helps each other with their problems. The color blue of the circle symbolizes the sky, because the sky is the limit. It also represents the color blue of the United Nations flag, where this symbol originated. That is all. Is there any questions? Yes.
How old were you when you found out you were diabetic, and what type of diabetes do you have?
I was 3.5 years old. I have type 1 diabetes, which is also called juvenile diabetes. Are there any more questions?
Yes. What do you do to control your diabetes?
I eat a properly balanced diet, I exercise, and I take my medicine as described. Thank you for your time.